In this morning's Healthy Living, we traveled to Cardiology Associates on the campus of Springhill Medical Center. We're talking about a heart condition that affects men and women, but there's a greater risk for females. Take a look. Here with Dr. Robert Robichaux. Thank you so much for joining us on Studio 10.
Happy to be here today.
We're here to talk about women and arrhythmia, starting with the very basics. What is arrhythmia?
Arrhythmia simply means a disturbance in the natural conduction of the heart. So it can be anything from a very benign condition to something very serious. It's a kind of a wastebasket term.
Taking it a step further, let's talk about what is atrial fibrillation.
Atrial fibrillation is simply, atria means the top chamber of the heart, and fibrillation means a quivering, so it's a quivering of the top chamber of the heart. So instead of the heart beating in its normal pattern from the top chambers of the atria down to the ventricles, the bottom chamber, there's a quivering in the top chamber. So the natural flow of blood through the heart is not as it should be.
What are some signs and symptoms that people will experience that may lead them to think that they have atrial fibrillation?
Absolutely. Our heart naturally has a pacemaker that makes us beat in time. And with atrial fibrillation, we do not have that. So you have an irregular heartbeat. So you would feel palpitations or extra beats or irregular beats. You also may feel a very strong heart pounding. And with that, people feel short of breath. They feel tired or fatigued easily. They may even feel dizzy if their heart goes fast in this rhythm. And in some cases, they may feel like they're going to pass or they may actually pass out.
Why should women especially be concerned with this? Well,
it's a disease that gets more common as we get older, especially after the age of 65. And since women live longer than men, as we age, the population of women with this condition increase. In fact, over 1 million women have this condition. But the real important thing is that women have a higher risk of stroke with this condition than men. They also are more symptomatic, so they have more hospitalizations, and the symptoms that I mentioned before are usually more intense.
So how do you diagnose atrial fibrillation?
It's a diagnosis from an EKG. We hook up a patient and we look at the electrical signal of the heart, and if we see that it has this irregular rhythm and the fine points of atrial fibrillation, the diagnosis can be made.
And then following with that, the treatment.
Sure. So the treatment for atrial fibrillation can be in stages, anything from controlling the rate of the heart by slowing it down with certain medicines, to also keeping the heart in its natural rhythm with medicines, as well as doing more complex procedures. We do a procedure called an ablation that can, in many cases, cure patients with atrial fibrillation. And then in late stages, we can put in pacemakers that can also help regulate the heart. So we have a kind of a broad spectrum of things that we can do.
And of course, if you're watching at home and you have any questions or concerns, you can get in contact with Springhill Medical Center and Cardiology and Associates. All that information is on our website. Just click on the Studio 10 tab on fox10tv.com. Dr. Robert Robichaux, thank you so much for joining us this morning.
It's my pleasure.
We appreciate it.